Well, it's great to be here with everybody, and I so appreciate you joining today, taking time out of your busy schedule, and especially on a morning like this, when the weather and the traffic just don't want to cooperate. I know many of you braved a lot to be here, and so we greatly appreciate it. Have a few others that'll be joining us as well once they get out of traffic. But we're here today, as everybody knows, for such an important cause. It's a cause that's important to me personally, but I know is important to all of you because we are all impacted by women's health. And at Wellstar, we are on a bold mission to create a healthier future for all Georgians. As one of the largest not-for-profit health systems in our state, we care for the whole person, their whole life, and most importantly, we care for the whole community. Wellstar is a nationally recognized leader in cutting-edge, innovative care, and at the same time, we are proud to play a critical role as the largest provider of charity care in the state of Georgia. In fact, out of all the health systems in the country, we provide the second highest amount of charity care in the nation. And you see, the care we provide extends far beyond the walls of our facilities, directly into the diverse communities we serve, whether it's urban, suburban, or rural. We strive to meet people where they are with the right care they need when they need it. And today, we're coming together to discuss one of the most pressing issues facing Georgia in our nation, and that's the state of women's health. Did you know that Georgia ranks 43rd out of 50 states in the nation for maternal deaths? And it doesn't have to be this way. In fact, 89% of these deaths are preventable, and that's what we're here to focus on today. So we're going to talk and learn more about why this is happening, but most importantly, what we can do to make a difference, what each of you can do, but what we can do collectively to make a difference. The number one killer of all women is cardiovascular disease, which is also a main contributor to maternal deaths. And for too many women, there's a lack of access to care, especially the preventative care and screening that can be life-saving. Every one of us here today is impacted by women's health. We all have women in our lives who are important to us. With your partnership, we can and will improve health outcomes for generations to come. When we come together to tackle challenges that prevent women from getting the care they need, we're not just caring for women, we're improving the overall health and well-being of our families and our communities. So today, you'll hear stories that impact and highlight the resilience of women and underscore the crucial role philanthropy, partnerships, and innovation play in ensuring every woman has access to the care they need when they need it. Philanthropy and community partnerships are a catalyst behind much of the work that we do at Wellstar, and they're put into action through initiatives and collaborations that prioritize unique health needs of all individuals that we serve. And we're honored today to have incredible experts, leaders, policymakers, both from Wellstar, the Department of Public Health, the CDC, the business community, and the philanthropic community as well. But we know talking can only get us so far, and we need to ignite movement and drive toward real solutions. So coming out of the conversations today, we will write and co-author a white paper that's inclusive of the ideas and solutions that you all help us bring forward. And this will help us clearly define a framework to address maternal mortality in the communities we serve across Georgia. This will also be helping us be one step closer to establishing a statewide public-private partnership aimed at advancing a comprehensive approach to address maternal mortality and improve the health outcomes for all women we serve. Together, we'll secure the right partnerships, raise public and private funding, and advance research and public education to create a new reality for women. Speaking of funding, I'm very excited to share that the Department of Health and Human Services, through the Health Resources and Services Administration, recently awarded a $5.5 million Healthy Start grant to Wellstar to address maternal to address maternal and infant health outcomes with a focus on 3 of the most underserved counties in the nation, but right here in Georgia: Troup County, Butts, and Spalding counties. This investment will help us launch our partnership in West Georgia, but will help fuel important work across every community Wellstar is in. It's an honor to receive this grant, as Wellstar is one of 6 organizations and the only integrated health system in the state of Georgia to receive this funding. This important grant, combined with recent philanthropic contributions, brings us to $12 million already raised to help us on our way with establishing this public-private partnership. So let's continue building on this momentum. I look forward to making great strides in women's health with each and every one of you. Let's begin that work together now by hearing firsthand from someone who's deeply committed to the health and well-being of women. And she's an experienced caregiver who hears the challenges they face each and every day. I'm excited to introduce you to Dr. Paula Graves, who's the Chief of Women Health Services at Wellstar. As an obstetrician and gynecologist, she is well acquainted with the importance of equitable, accessible women's health services and the ongoing need to improve women's health and maternal care in our state. It's an honor to have her as a partner in this important work, and she'll speak more about what we can accomplish and goals for the future. So Dr. Graves, I'm going to pass it to you.
I'm a little shorter, so I'm going to adjust it. Thank you, Julie, and thank you all for being here. Good morning. So don't look at what it looks like outside. It's just good to be here and good to see your beautiful faces. So I am privileged to have cared for so many women over the years. I was sitting there and I calculated almost 3 decades. So that's a long time. And I have been present for one of the most meaningful moments of their lives: becoming a parent. My patients in my community are the reasons that I care so passionately about making sure that every single woman in Georgia and beyond has the opportunity to receive personalized, high-quality, compassionate care every time. And we have a motto for our Women's Health Service line, and it's every woman, every time. But there are so many obstacles that still stand in the way of achieving this goal. Like many of you in this room and at Wellstar, we are committed to making a difference in many ways, from providing free prenatal care to many uninsured and indigent patients, to offering vouchers for screening and diagnostic services such as mammograms, to ensuring access to preventative care and cancer detection for all women. Many of the solutions we've offered already at Wellstar are making a difference. In the last year alone, the foundation helped Wellstar expand access across our state and into rural communities, and that is huge. That is my heart. With devices, equipment, and digital connections, our providers in Augusta, for example, can now monitor patients virtually, helping ensure the health and safety of moms and babies far beyond the walls of our facilities, meeting them where they are with the care they need. And we're committed now to continuing to innovate. Catalyst by Wellstar is partnering and investing in startups in the women's health space to bring leading-edge treatment and care for our communities. You'll hear more from one of the companies founded by Catalyst and how it's making a difference in the lives of women today. And with support from partners like each of you, we can continue to expand collaborations that bring access to leading-edge technology and find heart-driven, innovative ways to meet every health need for every woman, every time. These issues impacting women's health are vast, from the lack of research conducted with and for women, or access to nutritious food and community support. Many, many problems. But we have so much opportunity to make a difference and an impact. And we can discuss many of these at future events, but today, it's worth noting the standout statistics that you heard Julie mention. that brought us together here related to maternal morbidity and mortality. So the latest data released from 2022 shows that the U.S. maternal mortality rate has decreased. The statistics was 32.9 deaths per 100,000 live births before, and now it has decreased to 22.3 deaths per 100,000 live births. So the numbers to remember, 32.9 to 22.3. And even though that is a significant decrease, racial disparities persist. Black women are still 2 to 3 times more likely to die in childbirth as compared to their white counterparts, and this is an unacceptable statistic. It is one of the reasons that we're here today. As Julie also mentioned, and I want to underscore, Georgia's maternal mortality rate is still among some of the worst in the country, and more than 89% of these deaths are preventable. Additionally, social determinants of health, such as lack of preconceptual health, difficulty accessing care, difficulty navigating care, are some of the barriers women are facing disproportionately. Many of the diseases that contribute to poor maternal health also impact women of all ages across Georgia, such as cardiovascular disease, maternal mental health, obesity, diabetes, and hypertension. To truly improve women's health, we must determine how to address these comorbidities, as well as other factors such as implicit bias and racial and ethnic disparities. When we work to address these issues that keep women from getting care, the care that they need, the care that they deserve, we're improving the overall health and well-being of our communities. And that's for every woman, every time, at every phase of her life. I'll close by saying that women are responsible for acting as the care bridge across generations. They're caring for their children, their parents, their spouses, their partners, and their communities. But often they're forgotten, or they forget or have an inability to care for themselves. We must rally around the most precious member in our society that moves the needle. I'm proud that we are here today to work together on solutions to make an even greater difference. Critical to our success will be deepening our work with community partners, philanthropic organizations, donors, government, and innovators in these spaces. I'm grateful that we're joined today by many devoted advocates who share our vision for a healthier Georgia. And so now I'll hand it back to Julie and get us started. Thank you.
I am really pleased and grateful this morning to introduce and bring to the stage our esteemed MC for today, Monica Kaufman-Pearson. I think everybody knows Monica is a journalist and news anchor, or former news anchor, current host of her own talk show, The Monica Pearson Show. She is a 2-time cancer survivor and is passionate about using her trusted voice to influence change. A powerhouse of community benefit and a champion for women, she serves with Meals on Wheels Atlanta and Go Red for Women, and continues to be involved in transforming our communities for the better. And we couldn't be more excited to have her be part of this important journey that we're on at Wellstar and in all of our communities. She's an iconic woman, and she was the first female African-American anchor to anchor the evening news at our local WSB TV station. So we knew her revolutionary perspective would be impactful for our important conversations today and as we work together in the future. So with that, please join me in welcoming Monica Kaufman-Pearson.
What a morning. I got up at 5:30, got on the road at 7 a.m. I live at exit 228 off I-75 South. It took me 2.5 hours to get here. I could have driven to Chattanooga and back. But I'm here, and that's all that matters, right? We are going to have an exciting day, and we're going to make a difference in people's lives. Julie, thank you. Julie and I were on the phone, back and forth, back and forth. There was an accident at 10th and 14th. They blocked all lanes. So we just sat there. I listened to gospel music and prayed and kept my attitude good because I knew I was going to see all of your smiling faces. Yes, I'm excited about being here for so many reasons because I have so many friends who have been in that situation. And many of them are very well-educated women who, when they were in the hospital, discovered there were problems. And some of those problems developed before they became patients in the hospital. I have lost one friend who died after giving childbirth. I don't want that to happen to another. So I'm so glad you're in this room, determined to make a difference. I really am. Because, you know, I have incredible women friends and mothers who through their work and they deserve the best health care. Don't each and every one of us deserve the best health care? Yes. And it's our way of what we call fueling our incredibleness. That's what we do. I'm a mom too, and I know just how important it is for accessible, equitable maternal care, and how I also share your passion for ensuring that we are offering the best care possible in the state of Georgia, and it can be done. Now, Dr. Graves, as I understand, shared some pretty alarming statistics that show we still have a lot of work to do. So with us today, we're going to have a panel of several experts and leaders from a variety of backgrounds who will help us understand more about the challenges and more about the opportunities impacting women's health. It still surprises me, after all these years, we're still talking about this. We're still talking about this. So anyway, would my panelists please come on stage? I see we got a few thorns among the roses, meaning the guys. You're really not thorns, you're stems. Come on in. So I'm going to have each of you introduce yourself, if you don't mind. I'll start with you, Doctor.
Yeah, I'm Chad Ray. I'm an obstetrician gynecologist in Augusta, Georgia. I've been at the Medical College of Georgia under many names, now Wellstar MCG Health, and I'm a professor with Augusta University at MCG.
Good morning. I'm Deb Howery. I'm an ER doc, but I'm also the Chief Medical Officer at the Centers for Disease Control and Prevention.
Good morning, everyone. I'm Natalie Hernandez-Green. I'm an Associate Professor in the Department of Obstetrics and Gynecology at Morehouse School of Medicine and the Founding Director of the Center for Maternal Health Equity.
Good morning. My name is Katie Kopp. I'm the Director of Maternal Programs at the Georgia Department of Public Health.
Good morning. I'm Dr. Barry Mangle. I'm a cardiologist. I've been here in Atlanta for about 30 years and lead the cardiovascular service line for Wellstar.
Thank you all. So we have questions. Yes, give them a round of applause. We have questions directed to each of them. So I'll start with Drs. Ray and Dr. Mangle. From a clinical perspective, what do you believe is currently the most pressing issue facing maternal health in Georgia? Dr. Mangle?
I think there's probably more than just one. It's really almost the perfect storm of problems that we have. We've got a lot of risk in the population that's increasing. As you mentioned, Monica, there are issues that women don't know about when they go into the hospital, and we see increasing problems with hypertension, high blood pressure, with diabetes, with obesity, and multiple other cardiovascular risk. And so cardiovascular disease really is the leading cause of mortality. And the underdiagnosed population is a big problem. The other issue is lack of access, I think. Across the state, we have probably deserts of obstetric care, and that also leads to increasing morbidity and mortality, and that also stems from fewer and fewer physicians that are entering the field. So probably the perfect storm of issues that are leading to some of the problems that we see, not just here in Georgia, but across the country.
Dr. Ray?
Yeah, I've always taken the approach to, in academics and just in clinical practice in general to look at the evidence, and I think the evidence is very clear. I've spent the last decade working with the Maternal Mortality Review Committee, and I have really been in awe of what is the gold standard process by which we now have a much better understanding, and it's clear that cardiovascular disease and maternal mental health issues really affect most of our bad outcomes. And I think in general, when I get asked, what's the issues with maternal health, it's really more simple than that. It's health, right? And pregnancy really exacerbates conditions that were underlying, and for many, many reasons. Failure to optimize those conditions up front will certainly expose those conditions in pregnancy and postpartum. And now we know very clearly over a good long time that, in an evidence-based way, who's at the most risk, at what time are they at the most risk, and how should we, now, have our interventions affect those individuals that are the highest risk, and that will eventually affect everyone.
Okay. Now, Dr. Mangel, tell us about Dr. Teresa Bird.
Well, there's Dr. Ray and Dr. Bird both, who are leading the cardio OB programs at our respective institutions. And what that means is that they are helping to bring together teams of caregivers, teams of physicians who have really specialized in this particular area. And that's very important, because taking care of women who are pregnant, particularly women who are pregnant and have cardiovascular disease, requires a certain skill set. And not even all cardiologists have that skill set. And so bringing those teams together and then trying to geographically place those individuals in a way that allows the women from all over the state really to have access to the care is particularly important. And I think both of them are importantly leading this work in our institutions and spreading it out to the rest of the state through digital health, virtual health. There are many ways to bring this to the greater population. These programs tend to be in larger cities like Atlanta and Augusta. In order for us to really have an impact, we all believe we've got to be able to spread that work out, and understanding that we may not have the providers in those areas. We've got to think about other ways to do this work. And I would encourage the discussion today, because that's going to be really important for us to be able to do that in a more global way to impact the statistics that we heard about this morning.
It's interesting, both of you talked about the lack of availability of care. So Morehouse School of Medicine is trying to do something about that. Dr. Hernandez, please describe the maternal mental health challenges faced by women in Georgia. And then I also want you to talk about what Morehouse is doing to develop more physicians working with women.
Yeah, absolutely. Thank you for that question. So we know in recent Maternal Mortality Review Committee data that maternal mental health conditions are the leading cause of preventable death for women across the country. And the same is for Georgia. Particularly, my expertise is working with women of color and Black women in particular. Suicide and overdose are on the rise for Black women, and that's not often talked about, right? We see sometimes a picture of mental health or depression. A lot of us are not reflected in that. And we know that there's a lack of screening. Black women are oftentimes their mental health conditions are unrecognized, undiagnosed, and untreated. A lot of the screening tools that are available are not happening to Black women, particularly in lower income communities. They're not validated with Black women in those particular communities, and so a lot of it is being missed. And another thing that's been increasing as well is intimate partner violence, perinatal mood and anxiety disorders, which happens with 1 in 5 women, pregnant women. And a lot of that increase is actually severe maternal morbidity by 50%. Another startling statistic that a lot of people don't know is that Black women actually experience depression almost 50% more than other communities. And so there's a lot that's not happening, and we're going to change that at Morehouse School of Medicine. We established this Center for Maternal Health Equity about 2.5 years ago at the height of the pandemic, because the state recognized a need to address the inequities that are happening with maternal morbidity and mortality. And particularly how we do it is really by recognizing and amplifying the voices of Black women with those lived experiences, because our voices have been silenced for too long, and we want to recognize that our voices are legitimate sources of data and that we need to be engaged more often in creating solutions. And so we just received a 7-year multi-million-dollar grant from the National Institutes of Health to develop what we call the Center to Advance Reproductive Justice, Maternal Behavioral Health Conditions for Black women. In this, we're training the next generation of physicians and investigators to really focus on Black women and birthing people around maternal behavioral health conditions. One of our main projects is actually looking at how state-mandated reporting laws criminalize Black women more than other communities. We've developed mindfulness interventions that we're testing, a lot of really great projects that are coming down the pike. And right now, we're just working particularly with the communities who have amazing solutions and trying to amplify the solutions and not replicate what community-based organizations, and I see one, the Center for Black Women's Wellness, who's been a major partner of ours for a long time, Healthy Mothers, Healthy Babies Coalition of Georgia. I like to give them shout outs because they're really at the heart of creating the solutions and addressing maternal behavioral health, as well as maternal mortality and morbidity.
So the second largest group, I think, here are women of Hispanic origin. What is being done in that community?
Not too much. I think what's happening is people don't see the numbers and think, okay, they're okay. But one thing that we know is there's underreporting, right? Because with Latino women, a lot of them will check the box white. And there's still systems that don't recognize white non-Hispanic and white Hispanic. And then, Latinos, people often assume they're a homogenous group when there are certain subgroups. For instance, my family is from Puerto Rico, and Puerto Ricans actually have worse health outcomes than other Latino groups. And Georgia, and particularly Cobb County, has one of the fastest growing Latino populations, and then Puerto Ricans. Like right here at the Battery is the largest Puerto Rican Day Parade festival that happens. It's amazing. You should go and support Sel Familia, which is a great organization doing some of that work. The other thing that we're seeing particularly, and we're going to see numbers increase, is the anti-immigrant sentiment that's happening across the country, and particularly in this state. There are not a lot of protections for agricultural and migrant workers who are on the fields, with our onions and the tobacco that we all enjoy. Well, not tobacco. Hopefully none of y'all enjoy that. But all the fruits, and all the things that we enjoy, and their rights are not being protected. They're not accessing care for fear of accessing that care and being deported, or fear of them not being able to have their documentation status legalized finally after they've, trying to be a naturalized citizen. So again, many barriers, but I also see opportunities. I see opportunities for us to get involved. I see opportunities for us to use our voice when it comes to the election that is happening, and thinking about policies, because we can create the best interventions, but those are Band-Aids if we don't work on the systems.
I see some of your other panelists shaking their heads. Yes. So we're still talking about access barriers. So, Dr. Hori, let's talk about that a little bit more. How do we overcome these barriers?
So, I think what is so interesting is you can have access, but then you may not have the same quality, or there might be issues when you show up. And last month at CDC, we released a report about maternal mistreatment. And what we found was that 1 in 5 women experience mistreatment during the maternity care, particularly if you're Black or Hispanic.
Wait a minute, I got to stop for a minute.
Yep.
Define mistreatment.
So it means you could be disrespected or ignored, scolded, didn't have privacy. And again, this is what women said they were experiencing. And so I always want to say there's two sides, but that's how they were experiencing, it's how they felt. It's how, when they showed up, they felt their care was impacted. And so that's really important to understand. I was at Grady ER, for 15 years, and I very much understand how you might be super quick to do things, but you have to really listen to your patient, provide that privacy, listen to them, and bring them in. And that's one of the other things we found was that nearly half of women held back in answering questions or asking questions of their providers because either they felt ashamed or didn't know what to ask, or their family and friends said it's okay. And that's not okay. And that's why we have the Hear Her campaign at CDC, so that women are empowered to speak up. And I think back to I know you talked about losing a friend. I lost a colleague of mine a few years ago. She was an African-American woman scientist at CDC who did all the right things and died within a month of giving childbirth because she had high blood pressure and undiagnosed cardiomyopathy, and she didn't feel like she was listened to. She had warning signs that were missed. So you can have access to care like she did. But then you can have some of these issues that prevent you from getting the quality of care that everybody needs.
So is it a case of too many patients at one time, or is it a case of not caring?
Providers care. I mean, I think all of us would say we care. We are human. And I think that's where things like the Perinatal Quality Collaborative, CDC funds those, and the Maternal Mortality Review Committees we've heard about, that's where you can standardize quality of care. So focusing on things like high blood pressure, so no matter who you are, what hospital you're at, you get a standardized approach. In Louisiana, they saw that they decreased postpartum hemorrhage from making sure there were carts and documentation. So the more you can do things like that, you can improve quality of care for everybody.
I see Dr. Mangel chomping at the bit.
Well, I think it's also coordination of care. Women may start in one geographic location and deliver in another geographic location. And so having a team that's aware of pre-existing problems is really important, and that plan should be available to the entire team so that when they do arrive to give birth, everyone knows this is the plan that's been predetermined for this particular patient based on their pre-existing conditions. And those programs are, we've been developing them at Wellstar for a number of years, and I think have really been successful because those patients otherwise would arrive without the whole team knowing what had been discussed and determined to be the best course of action for that particular patient.
So, Dr. Kopp, what other factors aside from access to care do you think are contributing to the disparities in women's health?
Yeah, it's a great question. And Dr. Mangel, I appreciate what you said earlier, that there's a number of issues. Part of my role is managing our maternal mortality review committee. So we review every pregnancy-related death that happens in Georgia. And what we learned from that review is that there is not just one thing that could have been done to prevent the death. There's a number of things that needed to happen prior to pregnancy, during pregnancy, after pregnancy, and that could have happened in the healthcare system, but also in the community. And that's what I want to highlight here is the importance of social determinants of health when we're working on preventing maternal deaths and really improving health. It's not our goal just to prevent deaths. Like we want our mothers and birthing people to be well and to be healthy. And so where you live and the resources that you have in your community matters. Like, it matters that you have housing. It matters that you have transportation to be able to go to your appointments. It matters that you have access to fresh fruits and vegetables to go into pregnancy, being healthy, like Dr. Ray said earlier. So it's, when we're talking about the healthcare system, and, for me at the Department of Public Health, some of these things feel like, well, what can I do to impact housing, right? But that's really what we have to be thinking about, is how do we build up really healthy communities so that we have healthy people? And so using these non-traditional partnerships, I think, are going to be really important as we move forward. And also thinking about, how do we have peer support, and how do we have people kind of wrap around people as they're going through their pregnancy and their postpartum journey. So I love that Wellstar has the Healthy Start grant. That's hugely important. There's a number of ways to do this, whether it's case management, helping with care coordination, or peer support programs for mental health. But how do we really how do we kind of create that village that people need? I think that's one of the biggest issues impacting women's health.
Monica, I wanted to just elevate, one thing that happens, and, you mentioned your colleague who, her mom is a dear friend, and we work a lot together, but even the social determinants of health don't protect Black women. And I'll give you some statistics. Black women with higher levels of education still have worse outcomes than white women who drop out of high school. People will say, oh, chronic conditions, obesity. Yes, obesity is contributing. But even Black women who are of normal weight still have worse outcomes than all other women who are obese. And so there's something inherently happening that oftentimes we don't talk about that is also contributing, and it's racism. And it's not just racism, like people think, oh, it's about the doctors being discriminatory. It's not that. It's the racism that we experience from the time that we're born to the situations that we're put in all the time, which causes chronic stress, which is called weathering, which tears down your body. And Black women internally are almost 7 years older than other populations. And so a lot of that contributes to some of the inequities we see. We hear about women with PhDs. We see stories over and over again, even physicians who are still suffering, not just from maternal deaths, because I think we often talk about maternal deaths when we should be really talking about severe maternal morbidity, because that actually impacts people more than deaths, right? For every maternal death, there's estimating between 50 to 100 women who suffer from severe pregnancy complications throughout. And that's there's some other researchers that found that's underestimated, that there are more people that are suffering with severe maternal morbidity. So I just wanted to sort of highlight that, because I think as we think about solutions, again, there are Band-Aids, right? There are great interventions, but we need to be thinking bigger, and how do we imagine not just a healthcare system, but a society that honors and respects one another.
So that brings up the question of preconception, because as Dr. Ray said, we're talking about health, and heart disease is the number one killer of women above all the cancers combined. So we're talking about obesity, we're talking about high blood pressure, we're talking about food deserts, we're talking about a lot of things. So who's got solutions up here? Where do we start?
I have one. So we were also just funded through the National Heart, Lung, Blood Institute to really reimagine, as we said, I think one of those speakers previously, you just need to give people what they want in the ways that they need it, and meeting people where they're at. And so we know that 20 to 30% of women in the state of Georgia do not have access to healthcare insurance. And that's similar in other southern states. And so we're taking preconception counseling to the community, and we're working with Healthy Starts, First Steps programs, where we have an implementation science, randomized clinical control trial, where we're providing preconception counseling from lay people, so people who look like the community, in these community-based settings, to see whether it's effective, and then how do you uptake and scale a program like this up. It's been super successful in just the first year. that we've did this. This is a 5-year trial, and so we'll be excited to share some of those results. But again, it's not reinventing the wheel. It's just taking something that a lot of people don't have access to and giving them that access.
Who else wants to chime in on preconception healthcare?
I'll say that I think you said something that hits home with me all the time, which is, meeting patients where they're at. And I think getting into the community with access, we have focused in my system to, we're about to deploy mobile vans into the community. And we have a very robust virtual care platform, and it's really about trying to eliminate some of the obvious barriers of distance and loss, closing hospitals and perinatal units and having doctors leave those communities. So we're trying to outreach that way. But I think for me, it helps me as someone who takes care of patients one at a time at the bedside to really focus on the population health piece here, which is to look at the impact pyramid and know that what I'm doing clinically is going to have far less of an impact on the community than addressing social determinants of health. And if you don't screen for it, you're not going to find it. And if you don't find it, you're not going to have an intervention for it. So I think as we continue to screen broadly, widely, in communities where we are going out in meeting the patients where they're at, we will be able to identify more issues, optimize those, and then when they show up on our labor and deliveries, we will be able to have a much better understanding of where they were previously, and we're not reactionary to everything we do. We do have them on labor and delivery. Someone's pregnant, they're going to come to labor and delivery, and we can obviously, catch them at that point. We might not impact that pregnancy. We can impact what happens postpartum. We can also meet them in their homes for that with virtual care. We can have them seen in our mobile units. And those mobile units aren't really about a healthcare provider necessarily. It's about a team of people. The most important folks on our virtual care teams and on our mobile vans are the social workers. They're the care coordinators. They're the ones who are really, understanding more about what's going on in those patients. We are kind of going back to a time when we get to see in the homes. We are catching the systems failures from the hospital where patients go home and they don't have the meds that they need. And we weren't catching those before we were meeting these patients in their home.
So we know what's going on in the urban areas, and you in Augusta, you're kind of near a rural area. But how do we affect those people who are living on farms and not living in the city?
Yeah, I've seen this evolution in more than 2 decades in Augusta, where 5 health systems within our region in our public health district closed their perinatal units. And so we were catching patients who had no access to care, who were driving an hour. We know that it makes health outcomes, especially preterm birth, and the issues around maternal morbidity and mortality an issue. But it really is having some understanding of the traditional care we provided needs to be looked at in a much different way. Hybridize that care. And again, if we can overcome the barriers of broadband or access to telehealth, we can at least envision a model where we can deploy into those communities, partner with those in those communities too, whether it be churches, public health. There's brick and mortar in every single one of these places that we're trying to impact. But I've seen it change dramatically in 2 decades in Augusta, and it's two Georgias.
Dr. Coward?
So, I think what I would say is this is such an important role for community-based organizations here out in the audience. When we're looking at the social drivers that my panelists were talking about around healthcare, we saw even just for things like mammograms, that the more social drivers of health that people had, the less likely they were to get a mammogram, even when they were insured. And that included things we don't always think about, like social isolation. Certainly things like access to reliable transportation was important. So the more we can look at ways to provide that through health systems, and certainly in rural areas, the more ways that we can ensure that there aren't food insecurity, because if you're worried about your meal, you're not going to pay your copay for your mammogram. You'd certainly have much other stressors, but social isolation was something we saw that also really kept people from getting the care that they needed. And So I think we have to have all of that when we're thinking about how do we address this. Julie at the beginning talked about, the holistic picture, and I think that's so important too. When we're talking about women and preconception care, it's really just about healthcare, and focusing on chronic conditions like high blood pressure, obesity, diabetes. All of that impacts preconception care. And something that has been near and dear to my heart for about 20 years is mental health and substance use. And the more we can integrate that into routine care, preconception, conception, post-conception, that will really improve quality of life. So I think it's really about how do we incorporate healthcare and healthy well-being throughout a person's life, regardless of conception stage, but so they're healthy throughout their life and post-conception, so everybody can thrive.
Ms. Cobb?
Yeah, I agree with so much of what's been said. And maybe one thing that I'll add too is communities are so important because they also have their own solutions. Like communities know what they need. And so a lot of this as we go into developing this white paper is listening to that. There are 2 Georgias and there's, with so many communities even within that. And what's going to work in one area isn't going to work in another area. So I just want to lift up the voice of those communities as we're talking about these solutions because there's a lot of knowledge and expertise from them in our state already.
So what about, I was reading in the newspaper, I guess it was on Sunday, where they profiled 2 women in the nursing section who had been midwives or doulas. How much of that is being done now in the state? And how much would that help in this process of incorporating better health care?
Yeah, so we at Morehouse School of Medicine just established what we call a community-based perinatal patient navigation program. And this is where we take women with lived experiences and train them as doulas, we train them as community health workers, we train them as patient navigators, and we train them as lactation peer specialists. And we work with Black-led community-based organizations that developed all of these programming so that the programming is culturally relevant to them. And so they provide health education, they provide these wraparound services if the patient wants. They can serve as a doula for them, but a lot of it is really the health education and being that advocate for them as they're accessing care. And right now, we also got an NIH award to test the clinical effectiveness of this, right? Because if we want to change things, we need the data to show policymakers that they are making an impact. And really, the crux of what they're really doing is meeting the unmet social needs of the women that they're serving. But how do we integrate them into clinical care systems? Because, there's been a lot of, from providers, sort of like angst about working with doulas or working with, sort of this diverse perinatal workforce. And so a lot of our training is focused on really getting them connected, having them shadow a maternal fetal medicine specialist, having them shadow a social worker, a general OB-GYN, the certified nurse midwife, which a lot of hospitals have been integrating into their systems. And we're seeing results instantly. I mean, the stories that we hear of women, people talk about the 2 Georgias, but there are the 2 Atlantas, because if you're in South Atlanta, there is no access to care. There is really no place for a woman, particularly those that are historically marginalized. This is complete redlining that's happening right now, or that has happened within our care system. But we're trying to fill that void. And so our perinatal navigators are integrated into the system, but then we also have others that are just out there in any type of clinical setting. And so we're testing it at birth centers, we're testing it at fairly qualified health centers, a safety net setting, and now we'll be in Albany, Georgia.
So, Dr. Mangle, some women develop heart issues after their pregnancy. How is that? How do you kind of have a notion about that beforehand, and how is it addressed? Because I know of several women who, after giving birth, have developed heart disease.
A couple of points I'd make. First, getting back to what we were talking about earlier, and that is, I sort of see this as an iceberg, and what we see is above the waterline. A lot of cardiovascular disease lives below the waterline, and that's the risk. That's the risk that's out there. The risks that include things like high blood pressure, that include things like diabetes that many people just don't know about. And I think if we were able to detect that earlier, we might find that some of those complications could be prevented. After women deliver, there are a number of different problems. I'll speak specifically to cardiovascular because that's something that we see quite often. High blood pressure is one of the main areas, and women who develop eclampsia, preeclampsia, high blood pressure associated with pregnancy are also at higher risk afterwards of developing cardiovascular problems as they age. We know that. And so it's important that we pay particular attention and actually that we look at those women not just during pregnancy, but follow them more closely afterwards, understanding that the risk is likely higher for some of those complications. There are other problems that we see as well, peripartum cardiomyopathy. So women who develop heart failure after they deliver, and that can happen weeks and months after delivery, and becomes a very serious problem if not diagnosed. We have good treatments for that, but critically important because there's high associated morbidity and mortality with that particular condition. So again, I would focus a lot on the risks that women have that we just don't know about, and trying to screen, as we talked about, in the communities, getting out into the faith communities and setting up blood pressure screenings, things like that, blood sugar screenings, all become very important because we don't want to wait until the disease manifests itself above the waterline.
One of the concerns is postpartum depression, and a lot of women don't recognize it and aren't sure where to go to get help. So Dr. Cowrie, since that's your area, would you please speak to that?
So, I think it goes to what we were talking about care throughout, because for many women, they may have depression pre-pregnancy or might exacerbate during pregnancy as well as postpartum. So I think, at CDC, we have a lot of linkage to care. I think primary care is a great place to start with this, as well as a lot of community health centers, and really decreasing the stigma around it. I think a lot of people don't talk about mental health. That's why there's 988 now, which I hope everybody shares that number. That's if you have any sort of crisis, you can always call 988 and get connected. That's something the federal government did within the past year. I think really talking about it, asking about it, and providing support are the most important things anyone can do as a family member or a community member.
You all have done an excellent job. Thank you so much. Give our panelists a round of applause. So you've learned this morning that these issues aren't just about facts and figures. It's really about people and how those people are impacted, including many of us in this room and many of us who have loved ones who've been affected. So it's going to require people working together and caring together. And we're going to begin to work on that right now at your tables. Y'all didn't think y'all was just coming in here to sit, look at each other, and listen, didn't you? So I would like for each of you in your group to spend the next 30 minutes discussing the challenges we heard today around these 3 areas. Y'all ready? The first is preconception health. Preconception health. Everyone up here said the same thing. It starts with health, period. So how do we do that? Next, maternal mental health. And that's for the woman who was surprised that she's pregnant and really doesn't want to have that baby, or the woman who is having a difficult time getting pregnant. We often talk about having babies, but about the women who are trying to have babies and the mental health that's involved in that. And then, of course, postpartum. And then the last area in 30 minutes you're supposed to discuss access to care. How in your community or in your group can you be a part of that?
Ms. Bonner, good morning.
The reason I spoke to Ms. Bonner, when I moved here 48 years ago, she was one of the first women I met. She's been an activist in Cobb County from the day she was born. So I just wanted to say hello to her. She's special. So I'm not going to make it real hard on you. You can choose one topic to discuss, or you can discuss all of them. Each table, y'all have your designated captain. Will each designated captain raise their hand so there's no doubt about who your captains are? Okay? I see some tables don't have any designated captains. All right, we got hands up. And we want to make sure the conversation remains effective and focused on the issues: preconception health, maternal mental health, and access to care. Now, there is a sheet at each table for capturing feedback from your table discussions, and you can write notes on that, and we will be sharing some of those thoughts later. Your 30 minutes starts now. And again, to our panelists, thank you.
Yeah.
So now that we've discussed the many challenges that are affecting women's health, as well as opportunities for improvement, we're going to shift our focus just a little bit right now to what we all can do to drive solutions for the problems that we are facing. Our second group of panelists, come on up. So these women are venerable leaders in Georgia communities, and they bring a deep knowledge and perspective on solutions about working together across industries to create change. So I'll start out asking each of you to introduce yourself and tell everyone what you do. Mics are already on.
Good morning. I'm Dr. Joy Baker. I am a general OBGYN practicing in LaGrange, Georgia at Wellstar West Georgia Medical Center, where I serve as the chair of the Department of Pediatrics and OBGYN, as well as the Quality Safety Director. So I'm very pleased to be here with you guys today.
Hi, I'm Jennifer Newell. I am the founder and CEO of a company called Betty's Co. We are a women's health company focused on serving younger women. We do gynecology, mental health, and wellness, again, focused on women in their teens and their 20s. And we are really prioritizing meeting women where they are. So we have a mobile clinic, and we do virtual care as well.
Good morning, everyone. I'm Sharon Mason. I serve as the Cobb Chambers president and CEO, and we do a lot of work in economic development, workforce development, policy, advocacy, and look forward to this conversation.
Good morning. I'm Katie Kirkpatrick, president and CEO of the Metro Atlanta Chamber, and I do what Sharon just said.
Good morning, everyone. My name is Jasmine Crow Houston. I'm the founder and CEO of Gooder. We are focused on ending hunger and food waste, and I also serve on the board of the Wellstar Foundation. I'm very excited to be here this morning.
Good morning, everyone. My name is Angela Doinsala. I am the co-founder and executive director of Black Mamas Matter Alliance. We're actually a national network of community-based organizations and multidisciplinary professionals who do this work from the full spectrum of maternal and reproductive health programs, services, and care. We have quite a bit of folks who quite a bit of partners, I will say, even here in the state of Georgia, that does a lot of like doulas, midwifery work. A lot of our work falls in the categories of policy, research, holistic care as well, and then culture shift. We are the founders of the Black Maternal Health Week campaign, and we're very proud of that and what that has done to really elevate Black maternal health and the solutions to a lot of these issues. Thank you.
And this is our panel. A round of applause, please. Now, as we did with our earlier panel, I have questions to direct to specific people, but I also want to tell you all, if you hear something that you want to jump in on, this is a discussion, and we want to get as much information out as we possibly can, so don't be shy, okay? Although I have a feeling there's not a shy woman on this board. So I'll start out with Sharon and Katie. Georgia has significant challenges regarding maternal health. We also have many important businesses with corporate social responsibility programs, advocacy experts, and so much more. So what roles can business and government play in supporting and funding solutions that address these statewide disparities?
All right. I'll start first. So there's a lot of opportunity. I'll start with policy at the state level, and I know we have Representative Seaball here and probably several other representatives. But at the end of April, the governor signed, our Georgia governor signed a bill, House Bill 1046, which starts the Georgia Commission on Maternal and Infant Health. And as we've seen with other commissions, it gives such a great opportunity to do a deep dive on an issue like this that we know and we've identified. You've heard all the stats today, what a significant issue this is. And so from those commissions, we've seen a lot of policy come out of that help address the issue. It is a multi-year commission where their work will be done at the end of June in 2026, but this gives such a great opportunity to really influence that policy that will come out of that. And there's been other policy driven from the state level that addresses mental health, that addresses workforce. There was another commission that I know Mary Chapman with Wellstar served on for Georgia Commission for Healthcare, and that really helps address and for more people to get into the workforce fields. And we're talking about workforce challenges also impacts us as well. So that's the policy, but
well, I will say something that's probably provocative, which is we need to expand Medicaid. Now, if you're in the public policy space and advocacy space, though, that seems simple, but it's not, because it does have implications on other programs that are in the state. So we need to be careful in our consideration of Medicaid expansion. But when we think about especially maternal health outside of Metro Atlanta, the lack of hospitals and the ability to provide care, both perinatal and postnatal, then it creates a lot of challenges for our mothers. Now, Monica, you also asked about what businesses could do besides being advocates. The other piece on expanding Medicaid is obviously the economic impact that we lose in workforce productivity. And so as employers, we need to take a look at what our insurance offerings are, our benefits to our mothers, and I'm gonna add fathers. We have to remember that men are also part of this solution. It's not just women advocating for women, but that men need to understand what women need in order to be successfully pregnant or a child care giver, et cetera. And then the one last thing I'll leave you with too, and I think most of you know the numbers, that we lost so many women from the workforce due to the pandemic because the child care or elder care responsibilities often lie on the women. And so when we're, as employers, we need to think about what kind of benefits we're providing to the women in our workforce to ensure, one, that they can do the jobs adequately, but that there's flexibility and benefits available to support them as they provide both child care and elder care. Consider this. We lose $2 billion in economic activity each year due to lack of quality child care in this state. So there's a lot of options here, everything from expanding Medicaid to also looking at quality child care, and then also what we do as employers for our employees.
And I'll just add from the business employer perspective, we were talking at our table, there's so much opportunity for businesses to adjust policy, like Katie mentioned, to really look at how do we make it easier for employees, because there's a whole span of reasons why employees are behind on appointments, and it spans anywhere from access to transportation options to time. And so making it easier, partnering and having screenings and having a lot of great policy, in addition to the policies, having things like, we talked about a wellness day that companies are implementing. There's so many great best practices that businesses can learn from each other. And so actually at the Cobb Chamber, we started an HR roundtable so we could bring HR leaders together to share best practices like this. And we have one component around wellness and how do you help each other, learn from each other to adapt even better wellness programs and help your employees with mental health, because we know that's going to all help drive and make your business even better if we're all having great policies around helping our employees be their best selves.
Well, this is a question for all of you, and Katie brought it up. When we talk about expansion of Medicaid, we need to be talking about how do we address the issues with the Georgia legislature, since there are so many priorities in the state. I mean, how do you push women's issues to the forefront?
Well, first and foremost, data is compelling. So if you have data that can demonstrate with an investment what that return on investment would be for the state of Georgia, for Georgia families, that matters. That makes an impact. Stories matter. So telling stories about access to health care and how that can actually improve lives is very important. And I think the other piece, too, is we need to elect more women to the Georgia General Assembly. So, and let me be mindful, because I know that Senator Kirkpatrick is here. I think Kirkpatrick's in the back, and others. We can't, again, I'm going to go back to the men. We can't forget the men in our lives. They are also a force for good. And so making sure that we educate the men on what is necessary to support the women in their life and their communities can go a long way as well. But Monica, you know this as well as everybody in this room. There are tons of competing priorities that these legislators have to deal with. And we need to have a little bit of patience and compassion with them too, because they need the information to make good decisions. And so working as a partner is so important.
Yeah, and I think that's where that commission, if we're fueling our legislators with this information, with this data, that's where that commission is key. And Senator Kirkpatrick in particular has a medical background and has done a lot to drive legislation that helps in mental health and many other areas that are extremely helpful in this space. You go ahead.
What I wanted to ask, because I thought your response was interesting when you said our state legislators need more data and stories. And so I'm curious about what data and whose stories are you referring to? And I say that because there have been tons of well-meaning community-based organizations, advocates from the communities most impacted by maternal mortality, by a lack of reproductive health care, who have provided stories, who have done Hill visits, who have even rallied families to come and speak to our legislators, to advocate for the beautiful story that we just saw in the video about we needing more doulas in our communities, and also more midwives. And even when we saw the unfortunate closure of Atlanta Medical Center, folks were telling their stories and sharing their stories. So I am wondering what data and which stories do you believe will be of value?
So 2 quick points for you is one is it's a marathon, not a sprint. And so the fact that we elect new elected officials, although oftentimes the incumbents return, you have to remember there's always an education process, and it has to happen every single day. And sometimes it doesn't return a net positive right away. And sometimes, just on transportation, I can go back to transportation. It took 10 years for us to move the needle on transportation. But once we did, we had momentum. So don't give up. That's one thing. The other thing I would say, too, is hyper-local. So hyper-local, stay with the people that represent your local communities. That doesn't actually have to be the state representative. It could be your mayor, your city council, and others, because those voices matter as well. And coalitions and partnerships will really help advance. And if there can be one message and one set of facts that are used forward, I think our elected officials really appreciate that.
Monica, I want to jump in there, and I want to go with you, Angela. Yeah. But one of the biggest data points that's concerning to me that I know you'll share in is the fact that Georgia is last as it relates to infant mortality in maternal health. I mean, we just celebrated Mother's Day, and I think we should all be reminded, we talk about men, but there is no man without a woman, right? And so we have to celebrate and talk about the struggle that women are going through. And so to see that our state is at the very bottom of a woman being able to have a successful pregnancy, and I have a 3-month-old, and I'll share more, I'm sure. And I struggled. And so when I heard Dr. Hernandez give that fact that a woman with a PhD, a Black woman with a PhD, would have is more likely to face stress and trauma during her pregnancy than a white woman who dropped out of high school, that was really stressful to me because I just lived that exact story. So that's the data point. And I feel like any legislator, anyone that wants to hold an office in this state should want to move us from the bottom to the top.
And also, and if you don't mind for me to use you as an example, just wanting to raise that it's actually listening to the stories and caring about that data, and then taking the necessary action, and understanding that the action that is taken not only will benefit someone like yourself, but it will benefit everyone. And I'm so glad that you raised the point that unfortunately, Georgia is last, and I've been here all my life. I went to school here all my life. I love the state of Georgia, and I believe in the state of Georgia. We have so many wonderful resources, so many wonderful people that come out of the state of Georgia, and it's like the thought that, for example, we have less birth centers than the state of Texas. Give me a break. Things of that nature. And so understanding that even the services that we provide is still not even good enough for white women. And that's the part that we're also not talking about. White women are not getting the best care in our state. So if we center those of us that are most marginalized in our system, it's actually going to be beneficial for everyone. So if the first step is to further expand Medicaid, let that be it, and let that be of quality. And let's keep pushing the needle with the actual action that it's going to take to address these issues.
Maybe you can get the First Lady, who was so involved in human trafficking, with 3 daughters now. Maybe you can get her involved in maternal health. Sometimes you need somebody talking in your ear. Anyone else want to talk about this?
I'd love to chime in. A couple of thoughts. I don't want to downplay the importance of working through policy and advocacy, but for so long, women's health as a topic has been approached from that lens of the way that we're going to move the needle is through legislative policy changes or through advocacy, through community organizations and community work. I think one thing that is missing is the focus on, how do we create new innovative models outside of those two areas, working within the existing payment system and the payment model that's going to say, how are we going to look at what the customer really needs, think of patients as customers. In healthcare, so often, the customer is not the patient. And I think that's really problematic, right? So if you're a provider, your customer is actually the payer because that's how you're going to get funded. Well, if you're a payer, your customer is going to be the employer. If you're the employee, you have a really small voice. And so we need to really think about how do we treat the patient as a customer, create models that are going to serve them best, and then think about the funding source and how do we make it work. And so when you have a system that is focused on policy and advocacy, you're thinking about public funds, and then you're thinking about funds that come from individuals who are, or other organizations that are putting private dollars into that fund, right? You're not thinking about the funding that is coming from the customer, like customer-based funding. And so often, because of how the funds flow, you don't have systems that are going to best serve that end user, that patient, that customer. And so I think if we look broadly, and maybe this is where public and private partnerships come into play, but if you're on the public side, what we have is someone who is a private provider, what we have is we have a very specific set of criteria and programming that has to be met to get that public funding. Well, you're not going to get the best, most innovative model if you as the public entity are the one coming to the market, coming to us and saying, well, this is exactly what we need. And so what we need to do is create that space for innovation, create that opportunity for funding innovation that can come from the public sector, the private sector, and ultimately from the customer themselves, and giving them more power than what they have today.
I think you're right. Public-private partnerships is a major key to this and component. And we talked a lot about state legislation, but at the local level, there's a lot of opportunities for local partnerships that can drive and make a big difference. And I know in local community in Cobb County, our Cobb Board of Commissioners partnered with Cobb Chamber Select Cobb to implement from ARPA fundings $4.5 million for grants for daycares to help them stay open, because that affects our women, our workforce primarily, but really both parents and those kind of things. While pieces to the puzzle, they all add up and make a big difference. And so there are a lot of pieces that we have to address holistically, both locally and statewide, and look at those partnership opportunities.
So now I'm going to turn to Dr. Baker. Earlier you heard Dr. Hernandez talk about how all of this affects women of color, not just Black women, but Latino women. And then I was reminded at our table in Gwinnett County, you have a large Asian population, so they too can be affected. So what is the most effective way to address maternal health for these groups specifically?
Well, I think that it's so important that we actually start to center the people. And we talk a lot about patient-centered care at Wellstar. And so actually centering these folks, and I think particularly for me, centering Black women, because if we center those who are most vulnerable, everybody benefits. Just like Angela said, a rising tide lifts all boats. And so when I'm thinking about this in clinical practice and thinking about how we're going to improve our outcomes, I also think a lot about who are the most vulnerable people that I'm serving? Who do I really need to reach to make sure that we are able to provide excellent care for every woman every time? So the thing about that is, we were talking at my table that we're trying to figure out, like, how do you navigate people's implicit bias? How do you navigate how they feel about the person in front of them? Are they going to really be able to connect with that patient and build trust? And the truth of the matter is, if we all could figure that out, we would have probably solved this problem by now. But the one thing that I like to focus on is, what is the evidence? How can I provide high quality care and make sure my team is providing high quality care? And then how do we become accountable when that care is not delivered appropriately? And so it takes a lot of introspection from our teams, not only our community teams, but also our clinical teams, and looking at ourselves and saying, what is it that I'm hoping that this patient will get out of what I'm going to provide? And how am I opening myself to what the needs are of that particular patient? How do I meet them where they are? How do I understand what their needs are? And then how do I shift what I'm delivering to be what they need?
Anybody else want to jump in?
Yeah. I love Dr. Baker. And Dr. Baker does great work. And one of the things that I hope that everybody heard that Dr. Baker said was teams, and she talked about how can she works better with her team, and how can her team connect with the community. And so, and just wanting to connect, and I'm so sorry that I missed your name, but connecting back to the comments that you made about thinking about innovative funding structures. So one of the things that can better support a lot of communities of color seeking and navigating the healthcare system is, one, having available and access to team-based care as well, and being able to access care that with clinics that have that continuity of care, referral systems back into the communities, because a lot of the times what a lot of communities are needing, especially ethnic communities and cultural communities that are looking for particular types of health service delivery, is beyond the clinical setting a lot of times. And so, therefore, the more that we can be able to support through funding clinical settings that have strong referral networks, are able to have and make continuity of care, and those types of models of care that's both clinical and community-based, the better we'll see more outcomes. And I think that that's also another area that needs more funding and innovation.
I love that so much. We provide team-based care, and it's really interesting because we operate a mobile clinic. We see this perspective from the community that, well, I'm going to go here and I'm just going to get a screening. And it's a very transactional relationship that they are expecting. And so when you have, your community going in and saying, well, I'm going to get this screening, then if those next steps not only are put into place, but are managed, besides the patient having to do that management themselves, if they're managed and they have that support system, they're more likely to follow up. Even with us, even doing the care we do, because we serve mostly younger women, and we do mostly preventive care, we closely monitor the referral patterns of our patients, and we see how infrequently they go and take that next step. We have to talk to them several times and have several connecting points to make sure they just go follow up with, let's say we test them for A1C and it's slightly elevated. Well, they're not going to go to a primary care doctor and, have that continuous care that they need. They're just not going to go. They come back to us the next year and they're like, well, I knew it was high, but, I feel okay. So I'm just going to, continue. Let's test it again. And so then we do the same pattern. So we have to take responsibility for those connecting points downstream, which I think is important. The other thing I wanted to chime in on is thinking about the cultural components of the community that you serve is so critical. We're actually headquartered in San Antonio, Texas, which is vast majority Hispanic. And you see really similar data and statistics between, Black women in Georgia and Hispanic women in South Texas. Like, for example, South Texas and San Antonio has a 36% higher rate of cervical cancer than the national average. Well, we also know that Hispanic women are much less likely to have a primary care doctor. We know that in pediatrics, Hispanic girls are less likely to receive the HPV vaccine, and that is just, there are a lot of legacy mistrust in healthcare from Hispanic women in South Texas. And so we have to understand that. We also know that there's a legacy of kind of silence and stigma around women's health and reproductive health. And so families don't really talk as often as what you might expect if you are, living in, New England or California in a white family. You have those kind of social and cultural distinctions that are really important to understand, which we can only do if we have people on our team inputting information into Betty's in the way that we do things who represent that community. So we need to have providers who are Hispanic, who are from the community, who really understand the dynamics in that culture.
So you've talked about what we need to do, but I'm going to turn to Jasmine, since you're on the Wellstar board, on the foundation's board. How can philanthropy and grants make a difference with all these solutions we're hearing on the stage?
Yeah, they make a huge difference. I will go back to Julie earlier talking about the grant that Wellstar has recently received to provide care in some of the most at-need counties in this state. And even hearing Dr. Hernandez talk about the grant that Morehouse School of Medicine's received to provide mental health care. These things don't happen without grants. The money in health care is just not there. You're talking about expanding Medicaid, which is extremely important. But the reality is I sat through a session recently at our board meeting that talked about the actual decline in health. It's just, we have 10,000 people turning 65 every day. So we're losing nurses, we're losing people that are going to be just going into the hospital that have insurance. And now we are looking at having a huge plight of maternal health in our state. So we need more grants, we need more funding. They have the ability to be a little bit more flexible with what we're going to support. So whether that looks like providing more care for doulas, midwives, whether we're going to have mobile clinics that can go out to a lot of these communities that don't have access to care. This is where grant funding comes in, and it's really important that we as a collective get behind. It's not going to just be legislative. It's going to need to be money, as we all know, moves things. So that's where the grants are going to be really critical. And I'm excited about this recent $5 million grant that we received to deploy in 3 counties. But I think someone at my table told me there's 153 counties in Georgia.
159.
159, even worse.
Too many.
Yeah, so there's too many counties. So we need more money, and we need more grant funding to be able to deploy a lot of these services that we're talking about.
So that makes me turn to my 2 I guess we'll call you chambers, to basically ask, how can we get private industry, because it's to their benefit to have a healthy workforce?
Yeah, I was actually going to add, again, every stakeholder has a set of data that they're going to respond to. So if you can show the impact of the workforce and the health of the workforce and the productivity, it shows the bottom line for a business to make an investment. I wanted to follow up on something that Jasmine said about philanthropy. Philanthropy can also drive a few other things, one of which is telemedicine, the expansion of telemedicine, because that has a role as well for some of our community. And then the other piece is, you talked about trust. We trust people that look like us. That's an implicit bias as well, by the way. But we don't have enough Black, Hispanic, Asian spots in our medical schools and our nursing programs, et cetera, our doula programs. I mean, everything that makes an impact, we need to find a way to expand those services. And I think that's where you get into that public-private piece, right? So the public can make an investment, but philanthropy and private businesses can also make an investment in that type of expansion of programs. And you can look at what's happening at Morehouse School of Medicine and where they're going. That's largely driven by philanthropy.
And to help with that expansion, workforce partnerships, workforce nonprofits are absolutely key. And the grants that you mentioned will help drive. There's a lot of local communities that have major workforce components. I see our friend Sarah Ray, who represents the Douglas Chamber. She's the CEO of Douglas Chamber. And many chambers like us have a major focus on workforce, and at the heart of that is the partnerships that drive that. We were talking at our table. There's many solutions to workforce. Some of it is Dr. Baker mentioned quality care is at the heart and the top of the list of what we want to drive. But if we don't have enough workers coming into the fields to be able to deliver that quality care, then we're not setting ourselves up for success like we want to. And so having that intentional focus around our talent pipeline to help all levels, all stages of career want to get into the healthcare field is critical. And so partnerships like what Wellstar has with different college and career academies throughout the state helps our K through 12 want to match their passion and abilities and get into healthcare fields. Partnerships with great programs that help train those who want to change careers and get into a career like healthcare can help. And then we're talking about using AI. I know that's a hot topic, but how do we better utilize AI so we can make it streamline services and make it easier so the doctors can have more time with their patients, and that will increase the quality care as well.
So, Dr. Baker, what's on your wish list?
So for me, LaGrange is a much more rural area than Atlanta. And I think Chad talked about the two Georgias. That really does exist. And so for me, I'm always thinking about how do I get the resources to my team and to my patients. So I'm always kind of playing around with that. So if I had my way, one of the biggest things that we have to do is create community. And so at one point in my career, I was doing a lot of centering pregnancy, which is group prenatal care. But what we did was we had a room full of pregnant people and their partners, and we talked about just about anything you can imagine. There was a lot of education. There was a lot of opportunity for us to engage with each other. And now I'm looking back 7, 8 years later, and I'm seeing these families are still connected. They're still doing, life together. They're going on girls' trips with their toddlers and 5-year-olds. And so for me, that was a point in my career where I felt like I was really delivering high-quality care. I knew my patients. I knew their partners. I had an idea about what was going on with that. So creating community and being able to wrap as many supports around people as possible. I think there's a cocoon model that's out there now that's been floating around that I think is absolutely ideal, that talks about how you engage with patients for clinical care, how they engage with their community. I would love it if my local pastor called me up and said, hey, I saw a patient, one of your patients at church today, and she looks really swollen, and I think she needs a blood pressure check. That sort of community building and community education is really what I think we're going to need to move the needle. We only have access to patients when they come to us, right? But the rest of the time, they're with their friends, they're with their family, they're at work. And so we need to figure out how do we put as many supports in place around these patients as possible. So if I had to think about action items, I think that the public-private partnerships, making sure that there is funding available, making sure there's access available. And one thing I wanted to kind of piggyback off that Angela said was, what about the data? It seems like we've had a really hard time believing the data. And that's really unfortunate. As a physician and scientist, I'm dismayed by how much people sort of dismiss the data that we have. And I think that in order to really put together some action steps that are going to make a difference in Georgia, we have to, one, believe the data, and two, be absolutely committed to improving women's health throughout the lifespan if we really want to see a change in maternal health.
And sometimes it takes a person being affected personally for them to see the light, unfortunately. Well, we all know that it's going to take all of us here working together to improve women's health. So how can the potential partners in this room help us improve the health of women in Georgia? That's for all of y'all. How can the people in this room make a difference?
Well, and then I'm going to let, because I feel like she speaks the truth.
You're going to let Angela take over?
Yeah, I'm going to let Angela take over. I would just say, I mean, if you believe in the issue, then you have to be an advocate. You can't sit silent, right? And the other thing I would say as well is you do have to have determination and you have to have patience. You can't hit a roadblock and just say, oh, I'm done, right? We always, and I love the comment about innovation, because innovation also is kind of a hallmark of the United States, is we constantly think about new ways to do things. And so if there's any way for us to include innovation into those conversations, but the one thing I'd say to all of y'all is don't give up. Make sure that you raise your voice. And the other thing that works really, really well is build a tent. And what I mean is, who all can you pull in your tent together? And that could be for community-based care, right? It was interesting listening to you talk. I was thinking back to my first pregnancy, and I had 3 other women that delivered within 2 weeks, right, that were friends. So I immediately had somebody to say, oh my God, my child didn't sleep last night. What do I do, you know? Or I might not be feeling great. So I think community, that tent is important for the community piece, but when we're thinking about advocacy, and by the way, advocacy is not just with our legislators or our federal partners either. It could be businesses, it could be community partners, is build a tent, get everybody on the same mission with the same points and with the same stories, because when you're divided, it's a lot harder to get something done. But Angela.
Wait a minute, Katie.
Yeah.
You said something that earlier
Go for it,
that's
Monica.
been going through my mind. And it also ties into what Angela said and what Dr. Baker said. When you said that it took 10 years to get transportation, but nobody was dying.
Well,
with
actually they were.
transportation.
Well, no, listen, there's no comparison between maternal health and transportation. I was really using that as an example of how an issue, and by the way, people were dying. You do die in car crashes because of
You do, but not
poorly
as
designed.
many as women.
No,
that are
not
dying.
at all. But it just takes time with the right message, with the right person listening. And to your point about stories and data, if they're getting disparate stories and disparate data points, it becomes confusing. I'm just giving y'all, I'm just telling you what it's like to advocate.
Please.
So to have a concise message strategy, to have a concise position statement, to have concise data, and every single one of you is saying the same thing, that's how you move the needle. But if there are 10 or 15 different groups saying, well, I know what she wants, but I want something a little bit different, how are you supposed to make a decision? So absolutely right, women are dying because of this. So it's not a comparison to transportation, but sometimes large-scale change can take time, and I think you would all agree we don't have time.
Angela?
Well, what I would add is that, one, in terms of private and public partnerships and using that model, definitely, I do think that we have to be comfortable with being uncomfortable. I think that's the part that a lot of times, a lot of really good initiatives start to fall apart because there is going to be disagreement. We all do have different levels of priority. For some of us, one death is one death too many, right? And we need to do something now. And there are genuine solutions that don't have to take 10 years in order for decision makers to make something happen now. And I think that it's making room for that, it's making room for these multi-pronged strategies, and actually listening and retaining data from multiple sources, and not just what we consider as quote unquote hard data, but also the qualitative data. So, listening to the stories, not just of individuals, but of communities. We have many positive stories and positive outcomes from wonderful work that has been happening. I have to give some shout outs, if y'all don't mind.
Please.
Atlanta Healthy Start is one of them, have done wonderful work. Center for Black Women's Wellness, that's another great community-based organization. Feminist Women's Health Center has been providing full spectrum reproductive health care in our community since the 70s, and we need to keep their doors open. We also have a lot of other wonderful models that have been effective in the rural areas. We need more midwives, we need more mobile nurses, and more community partnerships that are happening all at the same time. And so if we can get more partners together who can understand the value of the sound of an orchestra. So, an orchestra has different instruments. Some of them are on different scales, but boy, when they make that sound and they're all, like you said, playing the same music, it's beautiful. And so it is possible for us to be effective and actually affect change a lot sooner, especially around maternal health and addressing some of these issues in our state, because we have quite a bit of folks who have already proposed pieces of legislation. I do have to plug in BMMA. We have released a comprehensive policy agenda. We are talking about all of these issues in this policy agenda and recommendations that can happen now. A lot of the folks that have inputted into this policy agenda work right here in our state, across the entire state. There's solutions around rural care, things that can happen here in Atlanta, doing more of this private partnerships, but like you said, at the local levels, right? But there's some local principalities that don't have as many resources as others. So our ability to be effective also needs to be looked at, especially from a resource distribution perspective.
So did you bring copies of that?
I didn't bring copies, but I can tell you where you can get it from.
Please tell everybody where they can get a copy.
You could definitely go to blackmamasmatter.org/policy agenda and easily download it. It's easily accessible if you go to our website.
So would anybody else like to chime in on how the potential partners in this room can help improve women's health in Georgia?
And to build off of that, Angela mentioned multi-pronged approach, and I think all of us can be part of the solution. There's so many ways that we can partner. There's so many ways that we can take back to our businesses or any businesses we're involved in and look at policy. How can we expand that policy to be even more supportive of women's health, of mental health, so many components there. How can we help with more best practices to encourage more businesses to make it easy for employees to have access and create a true wellness environment and wellness program that creates that thriving environment. So I think great opportunity for all of us to be part of the solution.
Anyone else? Okay, so yes, go ahead, Katie.
Well, the one thing we didn't talk about was our healthcare partners like Wellstar, right? These are not only do they provide treatment and preventative care, but they're also doing research. And I think research is fundamental too, and we have such a strength in this state around research that if we can drive more maternal health research, that's going to help inform and improve outcomes as well. So just wanted to throw that out there because of our density in this community here on research.
Thank you. I've got one.
I was going to say the Augusta Medical Partnership that Wellstar has is going to be a great step in that direction. So very excited about things coming there, as well as the grant that you mentioned and many other aspects.
So how many of you are moms? Okay. So to the moms, what is it you wish you had during the process to have a healthy, happy pregnancy and after pregnancy?
Well, I may be the newest mom. I have a 3-month-old.
3-month-old.
As of Sunday. And, I had just a really struggle with fertility as a whole. I struggled with fibroids. I had to have a myectomy and then got pregnant kind of really shockingly and surprisingly. But prior to, suffered several miscarriages. And so when I found out I was pregnant last year, I had my daughter at 39. The very first thing that happened when I walked into the doctor's office, they said, "Oh, this is a geriatric pregnancy." And I was like, well, dang, like y'all just making me feel really old. I'm already feeling like this is, it's just like, wow, this is, so I wish sometimes they could have talked to me a little nicer, because you made me feel old, and kind of they set the precedent of this is going to be a really struggle pregnancy, especially after I had 2 miscarriages prior to. So I wish that was better. And because of the fibroids, because of the previous miscarriages, I was really stressed throughout that entire pregnancy. I didn't tell anybody, as a matter of fact, that I was pregnant. A lot of people found out once I had my kid, because I was so fearful that this was not going to work. The first thing they're telling me is it's a geriatric pregnancy, and I have to have more doctor's appointments, and I was going to 2 to 3 doctor's appointments a week. And one of the biggest things that I would say is, even as someone who works, it was really expensive. And I think that is the stressor that I think a lot of people don't understand, is just how much it costs to go to 2 and 3 doctor's appointments a week, to see a perinatal doctor, to go to your regular OBGYN, to be worried about preeclampsia, and always checking your blood pressure. And I remember my doctor had me taking a baby aspirin every day, and just so many different things. And I went to about 7 doctors until I found one that I just felt was kind. So I think that is missing a lot sometimes in healthcare, is one, to your point, Katie, finding someone that looks like you, which to me was really shocking in Georgia, in a place like Atlanta that's 55% African American, to not have a lot of options for doctors that look like me without having to travel outside of where I lived. That was, a lot. One of the other things that I was going to add on to Angela's point, in what we all could do, is we also need to just think about like the social determinants of health that are really hurting a lot of people. And for me, I work in food access, and that's one of the number one. So many people don't have access to fresh and healthy foods. And as I was experiencing, coming and having a baby, a grocery store near my house closed. And so that was just another thing. And I'm someone who, again, I think has access, but even I struggled. And so I think, to the point of people that don't have as much access as me, someone who maybe isn't college educated, who is not a CEO, if I could be talked to crazy, which I was throughout the entire process, imagine what a mother in LaGrange, obviously she's not Dr. Baker's patient, because she would never say that, but imagine a mother in LaGrange or Griffin, someone that they struggle with. All the while, they don't even have a good start. And that's where we talk about these social determinants and how important that is, to make sure that we as people are doing more. And so I have done things like, since I've been a big supporter of for Kiara. I don't know if everyone knows Dr. Judge Hatchett, her daughter, for Kiara for Moms. I met her husband at a Harvard class I took last year. And so I've been supporting them. But we all could do certain things. So when Wellstar had our grand gala, I was really, rallied to support mammograms for women and to support doulas for women. So a lot of times we're waiting for somebody else, and we're waiting for the big grants to come, and we're waiting for the big money to flow in. But everybody could be doing something. I don't care if it's just today going home and going to BlackMamasMatterAlliance.org and downloading this policy agenda. Elections are coming up on May 21st. Iris is sitting at our table, is running, and she told us the election day, and I was like, oh, wow. So the elections, hi, Iris, but, elections are coming up. This is the time. We're in a huge election year, it's a scary election year at that, but we're in a huge election year, and this is the time to be having these conversations, but we cannot wait on anybody else. we all individually can be doing something, and that's the biggest takeaway that I have from, and granted, I think my biggest takeaway is my daughter, who's amazing, but a very stressful pregnancy all the way through.
Geriatric pregnancy.
A geriatric pregnancy.
I'm glad you changed doctors.
This was the lingo. This is several doctors told me that. And I was like, goodness, I wanted to get my degrees in my business and, be married and do so many things right before I had children. And I also have fertility struggles. So I would have much rather preferred it be called a blessed pregnancy.
Thank you.
There you go.
Very nice. Katie?
Just quick, also experienced the fertility issues on the front end, so having resources to help you there. Things around bed rest and other things that I had to do. How do you deal with that from a mental health perspective for someone that's used to being go, 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 make decisions, and then all of a sudden, you can't do, was very distressing. And then what I'd tell you on the flip side is postpartum. One of the things that I felt was missing was, how do I say this? I don't think my husband understood what it was like to be a new mother. So I wish there had been some research or information that could have been because I can remember at 4 weeks postpartum saying, I have got to get out of this house. I am about to lose it. Because I was very, very confined, and my husband didn't understand that. So he's like, you can't go out. You could get sick, bring something home to the baby. And I was like, this is a struggle at the moment. So I think some of that mental health and information on the front end and the back end. Now, my children are 20 and 17, so things may have progressed since I was pregnant, but those are things that I'd love to see more of.
So Monica, my daughter's about to turn 16. I have one, and we were very blessed to have Dr. Avril Beckford from Wellstar as our pediatrician, and she's amazing, and she would talk me through a lot of things. So I know she was trained very well by Wellstar on patients, and I think that's been a big part of Wellstar's culture. But also, what I would have loved to known at the time is really advice is take care of your own mental health, as you're doing so much, and moms and all of us, all the hats we wear, you're doing so much to fill other people's cups that you've got to make sure you're filling your own so that you can pour out into others.
I met a young lady during our break who said something I'd never thought about, and I told her I would share it. Her husband was in the military. She had her baby here, not here in Atlanta, but in the States. And she had no support system. There was no one in the hospital who could usher her through what she was going through, whether it be peer support or whether it be a friend. And I got to thinking, when I had breast cancer, almost before my husband could get through the door, Susan G. Komen was there. And then, bosom buddies and best friends. And I wonder, she made me think about that. Why is it we do not have within that team support for women who maybe don't have someone there to help them through what they're going through and what they're trying to figure out?
I think that is a key role for our doulas and community health educators. Yes. Since Wellstar opened the doula program, I have been talking to patients left and right saying, hey, would you like a doula? Here's a doula. Because that's exactly what they are there to do, is walk through that pregnancy and postpartum period. And, as much as I would like to think I'm the be-all and end-all in the room and I can do everything for my patient, the truth of the matter is I cannot. And so they're there to provide that education, to provide that support, to be there. And I think that that is something that we absolutely have to think about providing more. And as we wrap up, I just want to issue the challenge to everybody here to think about, what can I be doing to change the scenario? What can I do to wrap as many supports around patients, around my family members, around my community members as possible, so that we can begin to align our policy, our philanthropy, our workforce, our clinical care delivery systems, and our community care delivery systems. That's what it's going to take. It's going to take all of us. None of us can do this alone. It's not all just about the doctors and the healthcare systems delivering the care, but it's about how do we actually care for and center our moms.
Dr. Joy, you have the last word. Let's give our panelists a round of applause. You all were great. Okay, now that we've heard from all of our expert panelists about the various solutions that could be made possible through collaborative partnerships, we want you all to discuss with your table mates how you can support us in addressing the challenges facing women's health. Again, your table captains will lead the discussions, and we encourage you to join in the conversations. Please don't forget to capture your feedback and scan the QR code, you can see it right there, to the screen to share your thoughts electronically. We look forward to hearing your thoughts. You've got 30 minutes to work on this. Have fun. I can tell the conversations have been great at the table, and you have wonderful ideas. But we're here for a purpose, and that is, of course, to bring about change. So our call to action is going to come from the one and only Bird Blitch. But before that, you thought I was going to let you by, didn't you? Julie's coming up to tell us how good you did. Come on, Julie.
All right, we made it. I just want to thank everybody again for being a part of today. And remember, this is just the beginning. So coming out of this, if we remember nothing else other than the incredible information, not just the problem, but I think we all learned, if we didn't know before today, what we can start to do to make a difference, to improve the health of women, which means, again, the health of all of our communities. And so from here, the white paper that is going to be inclusive of a lot of the ideas and solutions that you all brought forward today, and we'll be in communication with you as we go in the shaping of that. And then the public-private partnership that we talked about when I opened us up this morning, and I think you heard that reiterated across the panels today. So at Wellstar, we are committed to help build a statewide public-private partnership with all of your support and partnership. So with that, I'm very excited to bring to the stage to close us out our foundation board of trustees, Bird Blitch, who is no stranger to healthcare. We talked a lot about the importance of innovation in this space. Bird is a nationally and locally recognized leader in healthcare innovation, and how we put technology to work to help us bring about the solutions that our communities deserve. So I'm going to hand it over to Bird and have him close us out. Thank you.
It's great to see everybody here today. It's amazing. I feel like we're starting to capture some real lightning in a bottle with these table conversations and discussions. As I think about a foundation, and the Wellstar Foundation is such a privilege to serve as chair, our role is to raise capital and deploy capital very efficiently around causes that we focus on today, such as health equity, behavioral health, workforce management, and innovation. But as we do that and we think about areas of need, I'm really excited to work with Julie and the team around this. I remember, if I look in the rearview mirror, I can remember when we sat down and Julie had some really big goals. And we talked about those, climbing to that top of the mountain and how hard it might be. And as we've gone down this journey, sometimes people listen to those goals and they laugh. And they think that we have really maybe overshot what we could think of as the possible. And we don't apologize about where we want to go and how we're going to get there. And to some extent, I look at some of the byproducts of that as the foundation helps the health system. And Wellstar today provides more uncompensated care than any other health system in the state. and number 2 in the country. I believe number 1 is Trinity, so you can think of like St. Mary's in Athens. They have a very different widespread network, but it still means that we have work to do. And when I look, maybe my second point might be around where we are today. If I look at Wellstar, 1 in 6 Georgians, they receive or have access to care through Wellstar. So that's an amazing thing. But yet, we've heard a lot up here today as it relates to women's health. I've heard last. I've heard bottom. I've heard 43rd in the state. I've heard and learned about cardiovascular disease being the number 1 cause of death for women. I've learned and I've learned and I've learned, and of course, we all, if I look at of those of us who are not women, we all have a mother, we all have a mama, and hopefully we may have a sister, we may have a daughter, we may have an aunt, we certainly have a friend. And when you combine that back to the business of healthcare, most healthcare decisions in the family go through a woman. You put all those things together, I look at business in so many ways. If it's working, we talked about this, if it's working, let's do more of it. If it's not working, let's do less of it. And so Wellstar has an opportunity here to lead, which goes to the third point around a lot of the issues that have been discussed and shared at these tables here today. This is not just a Wellstar issue. We talk about a private-public partnership. We talk about a white paper. We're going to talk about goals again. And these goals are also going to be aspirational. We are not going to apologize for what our goals are here and how we're going to get there. And the process starts as we leave and we think about that white paper and we think about the call to action and we think about the next time that we'll come back here to continue the conversation. Because nothing is really more important than some of these issues that we talked about today. If you don't have your health, you don't have a whole lot. And we're so lucky to live in a great state of Georgia, and we can take advantage of all the assets together because this is all of us coming together, many different partnerships and health systems, because this is about Georgia, this is about women in Georgia, this is about the future. And I feel certain if we take the lightning in the bottle that was captured here today, we will see results, and we'll hold ourselves accountable to those results. And we'll measure ourselves against our goals. And I believe that we will get there and see the positive outcomes of so many great solutions we talked about today. So thank you to everyone who came, who fought the traffic. I've heard that the traffic is much better now, but I'm not going to guarantee that or not set a goal around that. But when we leave here today, I really am enthused. I feel like we have great energy, and it's our jobs to continue to take this message out so that we can come back together and step by step start to achieve the goals that we know are achievable because it really does. The future starts today. Thank you so much.